Much fear in the African American community. Before you do anything, pray. And make sure that you're praying to get the answer and not praying to get your answer. Reconsider asking yourself why you are hesitant about getting it. To learn more, please visit weconsiderwa.org.
Mga kaibigan, ito po si Kuya Bert Kawili.
And this is Miles Salvador from Australia.
And I'm Norb Kawili, also known as Norbcam.
Kung gusto niyo po ang latest news and events from the Philippines at yung local Filipino community, Phil-Am Radio po.
We play Filipino music and interview guests from all around the world.
And I'll keep you updated on the latest Seahawks and sports news.
Kaya always tune in, Phil-Am Radio, every Tuesday, 1 to 2:30 p.m. Pacific Time on Rainier Avenue Radio App.
And in YouTube and Facebook. Salamat po.
This is Big Poppy, host of Jazz from the Cabinets. Join me each week for a listening tour of the first century of jazz, an eclectic mix of Dixieland, big band, cool jazz, bebop, contemporary jazz, world jazz, all jazz in all forms. That's Jazz from the Cabinets with Big Poppy on Rainier Avenue Radio, streaming worldwide on RainierAvenueRadio.world.
Welcome to the coronavirus pandemic. I'll take coronavirus for 100. Fever, chills, shortness of breath, loss of taste or smell. What is stay at home and isolate? Correct. Coronavirus for 200. Inability to stay awake, persistent pain or pressure in chest, trouble breathing. What is seek immediate help? Correct.
Coronavirus for 500.
Crippling and potentially dead infectious disease eliminated the United States with vaccination.
What is the polio vaccine?
Correct.
I'll take coronavirus for 700.
The Daily Double! Should I take the coronavirus vaccine? Wait. Hold up. This is not a game. It's time for serious discussions. We have coronavirus vaccines, but not everyone is comfortable taking them. Here's the facts. Based on what has been proven about vaccines for other diseases, COVID-19 vaccine may help keep you from getting seriously ill, even if you do get the virus. Getting vaccinated also may protect people around, particularly those at greater risk for severe illness from COVID-19. We don't yet have all of the answers. Get informed, talk to your healthcare physician, and make the right decision for you. This is a message supported by the Washington State Department of Health.
This is Paul Pearson, host of Star Time. And when I'm not meeting Mrs. Jones in that cafe for a chat and nothing else, I'm listening to Rainier Avenue Radio.world.
Hey. Noon. Welcome to Seniors Matter. I'm Brenda Charles-Edwards, the host of Seniors Matter. We're live every Friday at 12:30 p.m. Pacific Standard Time on Rainier Avenue Radio.world, your community radio station. You can also listen to us on YouTube, Facebook, Twitch TV, Twitter, and of course on the Rainier Avenue Radio app. We feature interviews with people that provide services or have valuable information for seniors, caregivers, and the community. Do you need financial documents? Do you need financial documents notarized? It's Friday. Do you need documents read to you for clarity or completion? Call me, Brenda, at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. May is Mental Health Month, and I understand that July is Minority Mental Health Month too, so we'll have to check that out later. My guest is Winona Hollins Hauge. She's a licensed clinician, she's a licensed clinical social worker and retired clinician. Welcome to the show, Winona. How the heck are you?
I'm fine, and thank you so much for having me this morning on this show, Brenda.
Hey, it is my pleasure. It's always a pleasure to have you. So, Winona, you are a very busy lady. You are in and out of the community doing so many different things. And I know that you serve on the UW School of Public Health as their National Community Committee Chair for the Center for Disease Control. What does that entail?
Yes, I have been involved with the University of Washington since I left Fred Hutchinson Cancer Research Center, and I have been representing them on the National Community Committee for the last, I guess it's been 8 years since I was chair of the CAB at the School of Public Health for the University of Washington. And in this role, we come together with people from all across the country. And we gather information, collect statistics, share data, and make sure that the representation and the voice of our people, particularly the African American, brown, and Black people, are represented in the things that happen. And this brings us to the discussion that we're in right now about COVID being one of the pandemics that we're dealing with, and racism being the second pandemic that we're dealing with. This position gives me a chance to undergird and feel the voices of people, feel their pain, feel their happiness, feel whatever is coming from the communities at large. And so that has been an advantage of representing the University of Washington in this capacity.
So, when we talk about the pandemic, how it's affected mental health, unfortunately, it has, so they say, raised its ugly head because, as you know, this last weekend, we saw examples of that, but not only mental health, but racism too. And it kind of reminded me a little bit of the Nazi time when people were being cleansed for the satisfaction of other people because they think they're a superior race. And it's really sad that we're still carrying this through. But I know that the pandemic has brought to light probably a lot of feelings that people had, but they've stuffed, so to speak. And from what, with the involvement that you have, would you say that that's a pretty accurate description of what's going on?
I certainly would. And I had the opportunity, being a representative from the University of Washington, to be a part of a panel for the CDC in April. And on that panel, a couple of things that just really struck everyone, and they weren't new to the presenters of the panel, amongst them myself and several other doctors from Morehouse and other institutions that represent their constituencies. One of the things that kept happening that was really blatant was the fact that the pandemic showed us what wasn't happening already in our communities, and it just put a bigger light. It shone the light on the disparities and the inequalities that are already present. And those are the ones that are weighted in our communities. And we bring all of that to the table. Then we get a pandemic where we're supposed to be resourceful and ready to better help and serve our communities, when clearly we're already at a disadvantage. They say sometimes, pull yourself up by your bootstraps. Well, if you're not wearing boots, that could be very, very difficult to do.
Absolutely.
And that's what we saw. We saw it very blatantly. We saw it in all of not only the racism that's been happening in our society, but we see it in our own communities. We see it with disproportionate numbers of Black people getting stopped while driving and ticketed while driving. That's been a recent issue in the community that I live in out in the northern part of Seattle. Which we are actively working and engaging the county on the counties in this area on those issues. But it's just perverse, and this causes stress for us. And that's why when you asked me to come on today, I thought, we do need to hear that it's okay to own the fact that not only is there a heightened issue of racism and things happening in our in the nation, but here we are coming together, and we have to deal with higher gas prices, deal with food shortages, deal with all the things everybody else is dealing with, and then we have the added layer of discrimination and intentional hurt and harm coming to our community. And we need to own up that this is not a normal, quote unquote, normal experience that we're having here with this dual pandemic.
And that's interesting that you should say that, because the next thing I was going to ask you is, what impact does anxiety have on Black women, since they face significant disparities in mental health care than their white counterparts?
It's interesting that when we go to the workplace, and obviously some people, when they enter a situation, they enter the public, you go in as one of the many people that's out there, but when we come in and enter into any of those spaces, we enter in as a Black woman, into those spaces. And so sometimes, unfortunately, we have the added layer of other people's expectations of who we are when we show up, how we're going to be acting, how we're going to respond, all of that.
That angry Black woman.
Yeah. So we come in with a whole set of expectations just because we're easily identified, and we haven't even opened our mouth or said anything or done anything, but
Right.
people have ideas and images of what to expect. And that's a burden of just being a person that comes to the community as a professional, in many cases into your workplace or your setting. But you still, no matter what, as we can see recently with the actually trying to get our Judge Ketanji Brown Jackson confirmed, you can see the ugly head of racism.
Yes.
And how that impacted and made it impartial and made it subjective, and did not allow for her to bring the credentials that she brings as an American, well-educated African-American woman. Before you can even get to that, there is that cloud that separates you from what it is that whatever office it is that you're trying to attain. And that's the way we have to acknowledge that is a part of what happens for us. So what do we do about that? Well, one is we build self-esteem. Coping strategies are strategies that allow you to own where you are, who you are, what you're feeling at that time, to show up in a space and to be who you are. What I'm saying today and encouraging us to think more about is, as we show up with who we are, the thing that we need to make sure we show up with is a toolkit. We don't just come to this just totally, oh, I didn't know there was racism, or, oh, I didn't know there would be people that would be intentionally trying to harm me, either, and as we say, collectively or individually. There are all different ways that people can harm people. But what we have to do is be secure within ourselves. And that takes me back to a book that I brought today as a reference, that I had pulled up for this discussion. And it's called Racism and Psychiatry. And it's by two psychiatrists. And it really hammers in and allows the clinician, and this was it's written for training purposes. I had my training through the University of Washington. I received a master's in social work from there back in, I say, the golden age, probably
back in the day,
77. So, obviously some of my tools obviously need to be sharpened, but and they have been, by just being lived experiences, my tools have had to be sharpened.
Definitely.
But the baseline here was the concept of how you show up and what you bring to the table. And it takes us back to our elders, and it takes us back to realizing that how important it is to have the swabana, which is meaning seeing you through the eyes of the elders. That if we bring that to the table when we come, then we feel undergirded and stronger in who we are. We have to do that first. We have to get in touch with ourselves, and we have to affirm who we are. And we cannot allow ourselves to be defined or insulted or put aside just because someone else has this idea or this perception of who we are or who we should be.
Or insecurity.
Yes. Thank you.
If you're just tuning in, you're listening live to Seniors Matter with your host, Brenda Charles-Edwards, on Rainier Avenue Radio.world, your community radio station. We're here every Friday at 12:30 p.m. Pacific Standard Time. Do you know what's the best gift we can give ourselves and our loved ones? Join me on Zoom for a group or individual session on end-of-life planning. Call me at 206-683-2636. Also, did you know that Nathan Yamani, he is a licensed managing director of YBG Healthcare, is awaiting state approval to open the first African-American hospice in Washington State. Now, this part is really important. A public hearing will be held this coming Wednesday, May 25th at 9 a.m. on Microsoft Teams. The call-in number is 1-564-999-2000. That's 1-564-999-2000. And then the conference ID number is 730-728-801#. That's 730-728-801#. We need everyone that's had any type of experience with a family member in their end stage of life, and they were not offered hospice care or were told little about palliative care. This is really important because as African Americans, we a lot of times don't get to know all the things that can make our passing a lot easier and easier on the family. So please check it out. You can also send emails to the Department of Health, and just do it. I'm going to be writing, and I'm asking everybody to write, please. So back to Miss Winona.
Thank you.
Winona, so you were talking about the toolkit.
Yes.
And I believe, correct me if I'm wrong, but are some of the things in the toolkit spiritual, mental, physical, and mindfulness tools?
Yes, they are. And I use that as a collective way to manage, to make the whole person. When you show up as the whole person, that means that you're not neglecting any of those areas. And what most important for me personally is to integrate those areas so that we get a healthy balance of diet, exercise, sleep. And let me emphasize sleep.
Yes,
and I'll say sleep because many of us are operating on a depravity of sleep. And we don't know it, but it definitely, the studies have shown now that many of the people that are inclined to be diagnosed early with dementia, that many of them have been misdiagnosed and do not realize they've had years of sleep apnea and have not been effectively treated for that and given whatever tools they have to work with that. One of the main things we have to do is look at our body and see how we are showing up. Now, we know as African Americans, exercise is maybe not our priority. I won't say I will say it hasn't been for me. And I will say it's starting to be for me because I have actually joined forces with many national organizations that I belong to who are recognizing the importance of getting off the couch and us getting out and walking.
You're part of Girl Trek, aren't you?
Yes, that's right. Girl Trek is what I'm leading into. I actually started a chapter of Girl Trek with Darnisha Weary out here, Diana Benton, Nurse Diana Benton, and several others who live in, and Carla Joyner, who live out here in the North area and North Sound area. And we are just tagging along with Trina Davis and Mikey Kane and realizing that it was really one of the founders of Girl Trek who really was from here. And Vanessa Garrison and Morgan were the two women who started the concept to get 1 million women walking and off the couch. Yes. So that's one thing for your health toolkit that you need to pay attention to is exercise. Secondly, sleep and making sure you don't get sleep deprivation. And if you need treatment for that, you need to do that. Thirdly, the diet is so important. Many of us are pre-diabetic on the road to diabetes. We have to stop and take control of what we can control. And that also plays into our emotions. Eating, if you're hungry, sometimes you think you're hungry, you really are thirsty. And those are the kind of things that we start needing to pay attention to make sure that our mental health is undergirded with some substantial care. Now, the other thing, mindfulness has come in as a great tool to use to settle yourself when you're getting ready to do your praying. Because I am a Christian and I pray. Pray is what I do. But there are people that need to get to a point where they learn to settle themselves down so they can even have time to think about taking care of self. This world will have us on a treadmill, and we have to be the ones to take ourselves off the treadmill and stop and say, all right, it's time for me time, husband, kids, job, career, all of that aside. If you're not in good health, as they tell you in the airline, put your mask on first before you can enable your children or the passengers next to you. Take care of self. So if nothing else comes out of today's messaging here, remember, it's important to use all 4 of those areas in your toolkit and to take care of self.
And that's not being selfish. Well, it is, but it's a good selfish.
A good selfish. That's
because
a good way to
if you're not in the right frame of mind and you're not healthy, you can't take care of anybody else. No. So it's okay. So can you tell us some local, regional, and national resources that can be accessed to keep us on this road?
Yes, definitely. And thank you for asking. We are really fortunate here in the greater Seattle area to have just a plethora of resources, that can really we can access. I just think right off the top of my head, one that Brenda and I have used, and that is Mount Zion Baptist Church has a health ministry call-in. That resource is available to anyone that's listening, and anyone can come on. It's used the second Sunday of every month. June 12th will be the next time that we will convene. It is a free telephone call-in, and we're actually using the prayer line that has been coordinated by one of our sisters, Sister Horton, who's in the counseling business and in the behavioral health ministry at Mount Zion. We have been able to come together with key doctors, psychiatrists, psychologists, agency owners, or agency directors. We come together to serve the community. Again, let me just tell you that is a free resource. It's a free telephone call. It's not a Zoom. And it happens every second Sunday at Mount Zion. In June, we will be addressing May as May being the Awareness for Mental Health Month. And we'll also be fast forwarding to look at the Minority Health Month, which takes us into the federal resources that we can use. You and I can right now go to hhs.gov. It's free, and you can utilize that to look at all of the resources out of the Office of Minority Health that they have that lifts up in the community. One resource that we have here locally is a part of an organization that Brenda and I both happen to belong to, and that's the National Council of Negro Women. And they have received funds from this HHS, the federal level, for a good health program. And it's a free good health program open to the community. You can access that by going to ncnw.org, National Council of Negro Women.org, ncnw.org. There are numerous resources that are listed. If you are able to access, or if you are coming to the community, we have the African American Reach and Teach program, which is, I brought in some of those resources just to give you the websites on them. We have the Center for Multicultural Health. We have the African American Health Coalition now, which has been reformed. It used to be the Washington State Association of Black Healthcare Professionals, which was run by the late Dr. Millie Russell and the late Dr. Alvin Thompson, which has regenerated itself to now the African American Health Board. And we have new leadership, and we are encouraging you to get involved with us and to see where we are taking health from a generational perspective further in our own community. The number I failed to give you for that second Sunday at Mount Zion is 1-425-436-6306. Again, that's 1-425-436-6306. And the code is 147230#. 147230#. Coming up this June, we will have a great speaker who happens to be a new member to Mount Zion, but not new to the community. And her name is Medina Salays, and she has Medina Salays Ministries. And she is a sports chaplain, a registered nurse, and a veteran that got to the level of major. And she is will be featured in the talk along with other physicians. We have invited, as we always have our regulars, we have Dr. John Vasso, Dr. Rayburn Lewis, Dr. Michelle Terry, Dr. Michelle Andrasik. We have our own medical director, Dr. Sherry Buckley, Steve Riggins, the veterans counselor, and myself. We all come together on this call to make sure that we adequately address resources. We also have invited a young man who's recently joined our church, and his name is Preston Anderson. He's a clinical social worker, master's level like I am, but he's active. And he will be on, and that's the way we go. We bridge the gap from what retired people have been doing. We take it all the way into active people and what they are doing. So that if you are interested in, or have a neighbor or someone that's interested in coming and listening, talking, asking your questions, and engaging, we invite you to use that resource.
That's fantastic, Winona. Wow. I didn't know that about Preston.
Yes.
Very nice. Very nice. So I'm going to have to wrap this up, but I do want to say I have a breaking news, as they say.
Okay, great.
I told you earlier about the young man that trying to start the African American healthcare hospice facility. Well, he and his they're partners, David Turner. They were going to be on my show on Friday, June 3rd and 10th, but I was able to get a slot for this Tuesday at 9 p.m. and Nathan will be on to talk about what's going on with the Department of Health and how they have to apply for the application to get this facility. And there's 3 other people competing for 2 positions. So I hope that everyone will tune in on Tuesday night at 9 p.m. It's called Community Spotlight. And as soon as I get information, I will send it out. And, you know, we have to speak at these public hearings. And if you can't speak in person, please send the comments to them. And once again, that phone number is 1-564-499-2000, 1-564-499-2000. The ID number is 730-728-801#. I'd like to thank my audience for being here today. I appreciate your support. I can't do it without you. Winona, it's been great having you on. I know that you will be back again with other good tidbits for my audience to hear. And thank you for the great service and that the trusted community servant that you are. We
Well,
appreciate
thank you. Thank you for the opportunity to serve. Again, I know that number you gave because it's to the state. I'm a former commissioner for African American Affairs for the state of Washington. And I really encourage us, as you said, to speak up and come to the hearings and to be active. So thanks so much.
You're welcome. Have a great weekend, everyone. Be safe. Live your life like it's golden. The coronavirus special edition is up next. Bye. Talk to you later, Winona.
Bye, Brenda.